My name is Jada Williams, and today I will be talking about hepatitis B. Today I will be talking about introduction, causes and transmission, diagnosing, treatment, strains, experiment, and the conclusion. Hepatitis B is a sexually transmitted liver disease that affects over 400 million people each year. It can be acute or chronic. When the disease is first contracted, it is acute. An acute disease is when the disease is short-term or does not last for a long period of time. If the disease is in your system for over 6 months, it becomes chronic. A chronic disease can be controlled, but it is not cured. Hepatitis B is transmitted through blood, semen, and some other body fluids. It cannot be transmitted through food or water, sharing eating utensils, breastfeeding, hugging, hand-holding, kissing, coughing, or sneezing. People at risk for hepatitis B are blood or tissue donors, hemodialysis patients, infants born to HPV-infected mothers, and pregnant women. A chronic infection may depend on when the disease is contracted. 90% of infected infants become chronically infected, while only 2 to 6% of adults become chronically infected with the disease. People under the age of 5 are generally asymptomatic, which means they have the disease, but they do not show any symptoms, while people over the age of 5 generally have symptoms. Hepatitis B can be diagnosed with a low-cost, simple blood test. If you have negative results, and you have not had a vaccine is recommended in order to prevent further treatment. If you have positive results, further tests need to be done in order to determine the stage of the disease. Hepatitis B can be treated with interferon or oral antiviral treatment. Interferon is a man-made copy of a protein that the body produces in order to respond to infection. And the oral antiviral treatments there are 5 oral antiviral treatments that can be used to treat hepatitis B. The first 2 are entecavir and tenofovir. They are strong oral antiviral treatment, and they have a high success rate. 2 others are lamivudine and telebuvudine. They are superior oral agents, but the risk for drug resistance is high. And adofovir is a final option, but has poor potency and has a low success rate. There are many different types of strains of hepatitis. There's hepatitis A, B, C, D, and E. Hepatitis pertains to the liver, is an infection or inflammation of the liver. Therefore, all strains of hepatitis pertain to the liver. Hepatitis A is highly contagious and is transmitted from person-to-person contact or consumption of contaminated food or water. Hepatitis B is transmitted through some body fluids, sexual contact, and shared needles. Hepatitis C is a blood-borne liver disease that is transmitted through sharing needles and other equipment. Hepatitis D is known as delta hepatitis because it requires hepatitis B in order to replicate its virus, which makes it rare in the United States. And hepatitis E is contracted by ingesting fecal matter in even microscopic amounts. Case study. Since 1990, New York has had a law requiring pregnant women to be tested for hepatitis B. Despite the law, there are still many medical errors which may put an infant's life at risk. In case study number 1, a woman is chronically infected with hepatitis B and is delivering her 3rd child. Unfortunately, her records say that she is hepatitis B negative. The infant did not receive the vaccine, but the woman assumed she did because her past 3 children had had it. By the time she realized, 1 month had passed. In case study number 2, a woman is in labor in a hospital. The staff learned that she wasn't tested for HBsAg because her physician said there was no reason to do so because she hadn't had hepatitis B for 2 years. She ordered the woman believed this was incorrect, and she ordered a test. The tests were not done urgently, and the infant was born before the results came back. They're later tracked down and given the vaccine. In case study number 3, an HBsAg positive woman gives birth. The infant was given the hepatitis B immunoglobulin, but not the HBV vaccine. The woman later learned the physician forgot to write the order for the vaccine, and the infant received the vaccine 2 weeks later. The point of my experiment is to see how the body's antibodies respond to the hepatitis B virus. In order to conduct the experiment, models have to be made of the infection in absence of antibody responses. The models then keep track of the body's ability to recover and regenerate after the disease. The models are based off of 7 adults who were identified with acute infection. It concluded that viral clearance can be achieved for a vaccinated individual for they have high anti-HBV levels. It further showed that clearance can also be achieved for low equilibrium anti-HBV antibody levels, which is an unvaccinated individual, when a strong cellular immune response is controls early infection. In conclusion, hepatitis B is a sexually transmitted liver disease that affects over 400 million people each year. It is transmitted through some body fluids. An infection may depend on when it's contracted, and is diagnosed with a blood test. That concludes my presentation, and thank you for listening.
Questions? So the mom has to get treated to prevent the child from being able to contract the disease?
The mother is tested for hepatitis B, and if she has it, she will be treated, and so will the infant.
Are there other things that can cause the child? Are there other things that the child can get as a result of the mom having hepatitis B?
As far as I know, they just get hepatitis B. Cortland?
What percentage of people catch hepatitis?
I'm not sure. That's a good question. Isaac?
When you were, it was something that, it was a word that, can you give me a definition of non-periodic?
What's the word?
I think it's non-periodic.
That means it's a rapid infection and it's like reoccurring to the liver. Junior?
Where is hepatitis B most common?
In Asia and Africa and developing countries.